Welcome to North Tees and Hartlepool Voices, telling the stories of our people and community in our trust.
My name is Elliot Kennedy, and with me in the studio today we have Roy and Marie from the Oral Health Promotions Department. Hello.
Hi Elliot, how are you doing?
Right, who are you?
It's a long answer to that, Elliot. We come under the umbrella of the Tees Community Dental Service. We've got a clinical team working in the community around the Tees area, an administration group based in Gisborough, and our screening team of Hannah, based with us, Oral Health Promotion Department at Helmsley House here at North Tees Hospital. Hannah organises the schools and the dental teams as we conduct our screening surveys of 5-year-old children. The results from this survey, which is almost complete for this round, which is brilliant, feeds into a national survey, giving us both a national and local picture of the dental health of our children. This gives us direction and helps in the commissioning of dental health priorities for Teesside. The OHPD itself is a small 6-person team, but we all come with a clinical background, mainly in dentistry. Marie, our line manager, Lindsay, Sue, Becky and myself have loads of experience of working in dental surgeries. And our colleague Karen, who's our glue, holds us all together, joined us from Cypher Ambulance and worked alongside the paramedics.
And what areas do you cover?
The 4 main Tees regions, Hartlepool, North Tees, Middlesbrough and Redcar and Cleveland. Roughly each of us works an area, but we help each other where we can and often support each other at health awareness events.
And how is your work planned?
We have a consultant in dental public health, Kamini Shah, oversees us, and she and Marie meet annually to determine our priorities, set us our goals and make sure everything falls in line with the commissioning team's requirements.
What is the OHPD's priorities and what do you actually do?
It's a nice simple question. It's got a big long answer. Marie, do you want to start us off on this?
I can do. Basically, we work right across the board. Children in residential care homes take our priorities. We have about 200 settings on our book, and the overwhelming majority of these are childcare centres, nurseries and primary schools. Our number one priority is to keep children out of hospital, trying to prevent tooth decay. Tooth decay is preventable and is caused by poor, often sugary diet and generally little or poor toothbrushing. We can't hide from it. Access to dentists in the UK is difficult. At the moment, obviously, it doesn't help the situation. However, prevention is better.
We go to the vast majority of schools and nurseries in this area. We deliver a toothbrushing programme to about 17,000 children, getting them into the habit of good daily brushing. Most importantly, because there's so few of us, we train people, we train the teachers to deliver this programme safely, cleanly and efficiently. We're funded by the local authorities to supply toothbrushes, fluoride toothpaste and storage racks. And Elliot, I think this is important. Parents can rest assured that this programme is delivered to the highest level of cleanliness possible. To achieve that, we go out to each setting and make sure that the preschools and the schools are delivering this programme safely. By observing, we go and watch the whole process from start to finish in all of the groups that take part. We also advise teachers on what is a healthy diet and what is not, giving them advice that underpins the programme and that they can use to pass on to parents, and especially those parents and children living in our most vulnerable areas.
Our other priority is the residents in our care homes. The emphasis here is to make sure that we encourage care staff to look after the oral health of our elderly or infirmed loved ones by providing them with the training and knowledge and hopefully the confidence and motivation to care for the people to the highest possible standard. We also provide training to our 0 to 19 services, including our health and social care colleagues.
And if that's not enough, we also work with our colleagues here in North Tees Hospital, for example, Ward 28, again training people to give them an understanding of how to help their patients achieve a higher standard of oral health and reduce the risk factors that can delay their recovery. We work collaboratively with other departments, for example, the Melissa Bus, where I think you and I bumped into each other, and are often asked to deliver training to outside agencies, for example, the START team, as well as frequently supporting health awareness events. We supported an inaugural STEM at Middlesbrough College event and carried out our own supportive presentations both here in North Tees Hospital and at Hartlepool Hospital. For example, the National Smile Month, and that's due up again, quick plug, 23rd of May here at North Tees Hospital when that will begin. We also attend the community forum, which often leads to collaborative discussions. And I think Marie would agree that for a small department we don't half get round.
Is the OHPD successful in this way?
We have statistics to prove that, for the first time ever, the North Tees region fell below the national average for tooth decay. Hartlepool, which is blessed with having fluoride naturally in its water supply, has always been below the national average. Sadly, the overall levels in the Tees region is far too high, and this is attributed to a poor diet which is high in sugar and often poor toothbrushing. There are still too many children being admitted to North Tees Hospital to have teeth removed, and often multiple teeth removed, under the general anaesthetic. As a department, we still have lots of work to do, but as a population, we have to truly realise the impact sugar and poor toothbrushing has on our children, and we have to act on that.
You can't keep dentistry out of the news, can you?
No, you can't. Sadly, it's never in the news for good reasons. The quality of dentistry in the UK is wonderful. Unfortunately, access to dentists locally and nationally is really difficult. This makes it even more important that we get our message over. Eat healthily, keeping sugary snacks to mealtimes when they have a reduced impact on the health of the mouth. Brush your teeth twice a day, and certainly last thing at night, with a toothpaste that has a minimum of 1,350 parts per million of fluoride, which covers most adult conventional toothpastes. And don't rinse out afterwards, just spit excess toothpaste out. And of course, see your dentist every 6 months unless they specifically advise otherwise. If you want to snack during the day, please choose something healthy like fruit or at least savoury. While dentistry is going through a tough time, we all have a part to play in keeping ourselves as healthy as possible.
What's the best bit of your job?
For me personally, I love watching the youngest children. When we go around to the schools and we're watching the children brushing their teeth, and we see the youngest children discovering toothbrushing, and going to a setting and seeing children develop this brushing, learning a skill that they can use every day at home and for the rest of their lives, and a skill that's going to enhance their oral health as well as their overall health.
Why did you say that brushing their teeth will improve the overall health?
The plaque bacteria that comes with poor oral health has long been associated with increasing the risk of other systemic diseases within the body. For example, oral cancer, heart health, diabetes, Alzheimer's, strokes, to name but a few.
What's the worst bit of your job?
Worst bit of my job is also the bit that drives me. Up to the end of the financial year 22-23, our clinical team carried out tooth extractions and, as Marie said, often multiple extractions to over 300 children here at North Tees Hospital. 300 children. We should all be saddened by these figures, but we should all be determined to drive these figures down. And the only way we can do this is by driving the good oral health message forward.
So what are the messages to people?
The message is a simple one, and it's an old one. Eat healthily. Sugar causes tooth decay. Eat sugar at main meal times only, and eat a healthy snack between meals. Everyone, brush your teeth at least twice a day, and absolutely last thing at night, using a fluoride toothpaste that has at least 1,350 parts per million. We prefer you to spit out any excess toothpaste rather than swallow it, and don't rinse out afterwards. Leave the toothpaste in contact with the teeth as long as you can. Help and supervise your children brush their teeth up to the age of 7. See your dentist every 6 months unless they specifically tell you otherwise. Let's try and get in regularly so that we deal with small problems rather than the big ones.
Every single one of us has a part to play. Look at yourselves first and make simple adjustments that will improve your dental health and your overall health. For example, reduce or stop putting sugar in your teas and coffees. If you're a parent, make sure your children are brushing their teeth twice a day, even from when their first tooth comes through, using an adult toothpaste, and keep sugar to meal times. If you're a grandparent, don't offer your grandchildren a sweet treat between meals. Try to keep that to meal times only. Offer them something different instead, maybe a piece of fruit. Dental decay and the sadness and trauma that surrounds it is preventable, so we can all do a little bit more ourselves.
Roy, Marie, thank you.
Thank you for joining us. Till next time, you've been listening to NTH Voices.